Well, thanks very much, Peter and Kevin. I had the pleasure to have them both in our office last week. It was a terrific meeting. We had the privilege to meet Ashish later on the same evening. So I am Jon Parks. I am the founder of CELF Technologies. What I'm going to show you here, let's see if, yeah. So Biosensor technology is in the same genre as something like Fitbit or Apple Watch. Those technologies built upon something most of you are familiar with called pulse oximetry plasmography. Historically somewhat accurate when you clip it onto the ear and go to a hospital. Not very accurate when you put it on your wrist. It's a quick disclosure statement from our lawyers that we all love. So I'm going to start off showing you the substance of what we've done because it'll help to make the point. What we're looking at here is what we believe clinically accurate, perhaps much greater accuracy than the top-of-the-line General Electric Marquette, which is a 12-lead EKG machine. Typically, you'd need to visit your clinician for that. They would want to ground your leg. They would perhaps put you in a shielded room, of course, tell you not to move. EKG is a very noisy data set. Essentially, you're looking for 1 millivolt, which is lost in more than 1,500 millivolts of electrical interference, maybe another 300 plus millivolts of interference that comes from the placement on the person. It's just if you put 2 wires on an apple. And then several hundred millivolts additional interference from what they call muscle artifact. This is the other electrical emission coming when you move around. Let's see if this works.
And from a wearable I currently have on during this recording, I'd like to demonstrate the new CELF app for EKG. Here you can actually see the EKG that's streaming live from the app with pulse rate. In a landscape mode, you can behold the 12 bits of granularity and resolution that's only possible from our DSP signal processing.
Now I'll show you another very quick video, something that most anyone who's administered an EKG would not find credible. And this is of me wearing our EKG sensor in the subway beneath Times Square. And you'll notice when I do that, the subway rolls past and the EKG doesn't flinch. It does. You get a lot of information here. So what does this all mean to you, to us? What is it going to mean to people who potentially have different types of heart condition but don't yet know it? This was our dream. What we expect is that by the end of next year, 2017, we can have as many as 1 million people wearing something like this 24/7. So just imagine ultra high resolution electrocardiogram streaming into the Amazon cloud. Their data, their personalized data, anonymized of course, but with these very valuable data available to the research community. This has been a pipe dream for years and years. Some of you are probably familiar with the Framingham study, still the largest heart study of its kind. More than 5,000 subjects, originally enrolled in 1948. This is now in its 3rd leg. I wouldn't exactly term it a marvel of diversity. They picked a suburb of Massachusetts, so Framingham is named for the town. Just a quick bit on our company. We're just a very small team working 24/7 around the clock, like many of you. We take our mission, our purpose very seriously. We believe we need to get this out to as many people in the shortest time as possible. So how are you going to do that? Half the country can't pronounce electrocardiogram, the other half don't know what it's good for, and just a tiny fraction of those would know how to read one. And the short truth to that, the disconnect between what we all want and what the public wants, is that nobody cares. Nobody's asking to wear a Holter monitor to the beach. They don't, most of the time, want to partner with their clinicians for better health care. What they want, however, what they've demonstrated they're prepared to use and wear all the time are fitness wearables. So we have to be very clear about this disconnect between what we're doing and how we're going about it. What we're doing is we're trying to obtain all of these data that we may believe are very valuable. But we're consumer-facing. Our first expression, so to speak, is a wearable for the fitness category. And that user, of course, will not see his or her EKG. They're not interested in that. What they will have are apps and solutions that are valuable for a fitness application. Their personalized cardio capacity, which the Fitbits of the world cannot give them now, probably never will. Their personal level of respiration, EKG derived, and also a personalized measure of hydration, and then a lot of opportunity to supplement those data with questions that you all might find very valuable for your applications. And this is what it looks like. This is actually our 4th generation board. We're going to market now with our 5th generation board, which is still smaller than this one. It's the whole thing right here in my hand. There's a little bit of depth on the real board because you've got a battery that's going to flatten out like a pancake. You've got a USB port, which we've done away with. It'll be inductively charged. And this is all stuff that we're doing in several weeks, certainly not months. We already played this video, but this is just a short clip of what the EKG looks like. This is Frank Cooper. He's president of our company. You might notice along the x-axis, we're capturing this with quartz clock accuracy, so think millionths of a second, with FDA-compliant time series. By the way, the team have put things through the FDA before, more than 10 times, but our roadmap here doesn't address that for quite a while. So there's final guidance from the FDA right now, and anyone who needs that, I'll be happy to send it around, but you can Google it, on what constitutes something that would require regulatory approval as opposed to that which is not providing a medical measurement, diagnostic dosimetry, which does not yet require regulatory approval. And interestingly, very, very valuable. Most of what we need to do, all of us, and to serve the people we're trying to help, can be done precedent to certain types of regulatory approval. So again, this is just a quick picture. We're able to stamp these out. We're in iterative production now on Long Island. This is a pharmaceutical grade 6 Sigma, FDA compliant production line. Our guys actually put them in business years and years ago. From there, we go to a much larger company. We could do about 10 to 30,000 pieces a month here. It switches very quickly. We can do about 100 to 300,000 pieces a month. And then they've got 2 facilities completely replicated in China. Again, all 6 Sigma FDA compliant, risk auditing all the way through. So much as we were describing earlier that you want a minimally viable product, it's not too early to start thinking about a roadmap. Ultimately, you got to get this onto people, or if it's an app, you have to have people using it. And with that, we didn't have a lot of time. I want to take leave some time for some quick questions. So let's open it up. Yes, sir.